Good afternoon and welcome to today's newsbrief. Last night, State Governor Carlos Mendoza Davis addressed the people of Baja California Sur to announce extraordinary actions to better manage phase 3 of the COVID-19 pandemic. In his address, he reported that a decree would be published today. The decree was in fact published earlier today, and it states that it will go into effect tomorrow, April 25th. This decree establishes the following extraordinary norms to prevent and control the COVID-19 spread during phase 3. All non-essential activities are going to be suspended until May 30th. Transit will be restricted to one person per vehicle and only allowing those that meet the requirements established for essential activities and special dispensations. There will be zero tolerance for those that leave their homes without justification. The use of a face mask is mandatory for everyone who leaves their homes with COVID-19 symptoms. Those who do not comply with these norms will be arrested for up to 36 hours and fined. Those that cannot pay the fine will perform community services for 3 days, transporting food to vulnerable groups, cleaning health centers and hospitals, and similar activities related to this contingency. The security forces at the municipal, state, and federal level will oversee the observance of these norms. If you'd like to read the entire decree, it is available for viewing in Cabomilradio Facebook page. The Secretary of Health for the state of Baja California Sur released the current data on the situation of the COVID-19 pandemic during a virtual press conference. As of today, there are 250 confirmed cases, with 197 still active in Baja California Sur. The state has an incidence rate of 4.84% in the last 15 days, placing Baja California Sur in the 6th position in Mexico. You will recall that a few weeks ago, the state reached the first place, then the second, only below Mexico City. During her participation, Ana Luisa Guluarte Castro, state coordinator for the strategy against COVID-19 in Baja California Sur, noted that 66% of the registered cases occurred in the municipality of Los Cabos. In the state, the cases were mostly managed by the Mexican Institute of Social Security, also known as IMSS, with 66% of all cases reporting to IMSS and 16% reporting to hospitals managed by the Secretary of Health. However, 92% of patients have been treated via telemedicine and are maintaining home quarantine. 3% of all patients are hospitalized in stable condition, and 4% have required assisted respiration, and their health status is considered critical. 42% of the cases correspond to people over 70 years of age, and 100% of the deaths caused by COVID-19 are people with other chronic diseases or conditions, such as diabetes and hypertension. The main symptoms reported by people with COVID-19 are headaches, reported in 91% of all patients, followed by fever and other symptoms such as nasal flow and body aches. As of today, according to the Baja California Sur Health Secretariat, 41% of the cases have recovered, and during the weekend there could be more recoveries registered. Also, the Secretary of Health, Victor George Flores, announced that they are working in an alliance with hospitals and private clinics in the state to expand hospitalization and medical care services for the entire community if necessary. Health authorities in Baja California Sur trust that with the decree issued by Governor Carlos Mendoza Davis in the midst of phase 3 of the pandemic, which restricts mobility to only strictly necessary activities, the contagion curve will flatten and will be controlled to avoid the collapse of medical services in the state.